An audit by the federal government, specifically the Department of Health and Human Services, found that 1 in 7 elderly nursing home residents, nearly all suffering dementia, are given antipsychotic drugs, even though the medicines increase the risk of death and are not approved for such treatment. Daniel Levinson, Inspector General of HHS, noted that some drugs are potentially lethal and that some drug manufacturer illegally marketed these medicines for these uses, putting, as he quotes, profits before safety. Now, of course, they got a lot of backlash for a very specific audit that they did. And so they came back against this backlash to say that some of the inappropriate use of antipsychotics in elderly in nursing home patients is a result of drug makers paying kickbacks to nursing homes to increase prescriptions for the medicine. And specifically cited was Omnicare, a pharmacy chain for nursing homes that had to pay $98 million in fines in November 2009 to settle accusations that it received kickbacks from Johnson & Johnson and other drug makers for antipsychotic prescriptions. 83% of antipsychotic prescriptions for elderly nursing home residents, they found, were for uses not approved by federal drug regulators, and 88% were used to treat patients with dementia, which actually can be lethal. So, this whole area of drug interactions, overprescribing, underprescribing, how they all mix together, it's a huge issue. You need to be a good patient advocate in your corner to track these issues. We've certainly gone through this with my mom over the last 4 months. She just got out of rehab. Probably could have shortened that rehab cycle a lot if it wasn't for some of these exact same issues. I did have my sister advocating for her, but sometimes you don't have the bandwidth to be able to do that, and you need to reach out for help. That could be with a registered nurse you might know, a patient advocate, a geriatric care manager. The thing is, there's a lot of things going wrong in nursing and assisted living. I've witnessed it firsthand, but you really have to be diligent, and sometimes you can't be diligent by yourself. Thanks.